During the pandemic, doctors and data analysts at Intermountain Healthcare have developed innovative artificial intelligence methods to better treat patients with COVID.
As news specialist Jed Bowl reports, they're using data analytics tools and algorithms to help predict risks for COVID-19 patients and find the best treatments. Jed?
Yeah, Dave. Doctors and IT specialists here at Intermountain Healthcare are crunching our health data to try to determine who will have the worst cases of COVID and also who will respond best to antibody treatments.
Identifying which patients are at higher risk of having poor outcomes is a very important part of healthcare delivery.
Dr. Brandon Webb tells me that's how they personalize patient care. The infectious diseases physician and chair of the COVID Therapeutics Committee says that principle is not new, but it's critical in this battle with limited resources.
Where we have a disease that in most people causes a fairly mild disease, and yet in a fraction of patients causes a terrible disease.
When a patient tests positive for COVID-19, caregivers use data analytics to determine who is at risk for being admitted to the ICU, who is at risk to develop COVID hyperinflammatory syndrome, and who may benefit from monoclonal antibody treatment therapy.
So we recognized right from the first days of the pandemic that collecting information about COVID was going to be really important, and we've been doing just that.
The analytics enabled care managers to contact 1,500 at-risk patients at home to help them take precautions. The tools also help them give antibody treatments to patients who need it the most, preventing the hospitalization of more than 150 people who might have gotten sicker or even died.
That's a game changer.
For the hospitals, too.
150 patients less in the hospital is 150 beds that can be used to care for other patients who need it.
Dr. Webb and other researchers published their findings in December in the medical journal Lancet Rheumatology. They wanted to make sure that they could share these innovations with other professionals.